Welcome to another episode from the Veterinary Medicine Digest. Today, we are diving deep into a topic that affects the vast majority of our canine companions, yet often goes unnoticed until it is too late. It is a silent epidemic that begins with something as seemingly innocent as bad breath but can lead to chronic pain, tooth loss, and even systemic disease affecting vital organs. We are talking about periodontal disease in dogs. If you have ever wondered why your veterinarian is so focused on your dog's teeth, or if you have ever dismissed that doggy breath as just a normal part of life, then this episode is for you. We will explore what periodontal disease really is, what causes it, which dogs are most at risk, and most importantly, what we can do to prevent and treat it. So, let us start with the basics. What exactly is periodontal disease? It is not just about tartar on the teeth. Periodontal disease is an inflammatory condition that affects the periodontium, which is the specialized group of tissues that surround and support each tooth. This includes the gums or gingiva, the cementum that covers the root of the tooth, the periodontal ligament that acts as a shock absorber connecting the tooth to the jawbone, and the alveolar bone itself, which is the bone socket that holds the tooth in place. The whole process is kicked off by the buildup of dental plaque on the tooth surface. Plaque is not just leftover food. It is a sticky, colorless biofilm composed of bacteria. This plaque formation happens in stages. First, a layer of salivary proteins called the pellicle forms on the tooth, which is then colonized by bacteria that mature into a complex microbial community. If this plaque is not removed, it can become mineralized by the salts in saliva to form calculus, also known as tartar. While calculus itself does not directly cause the disease, its rough, porous surface provides a perfect scaffold for new plaque to adhere, making the problem worse. The real damage, however, is not caused directly by the bacteria themselves, but rather by the dog's own immune system launching an improperly regulated response to this persistent bacterial infection. This leads to inflammation and tissue destruction. The disease is typically separated into two main conditions: gingivitis and periodontitis. Gingivitis is the earliest stage, where the inflammation is confined to the gums. You might notice your dog's gums are red, swollen, and may even bleed when probed or brushed. The good news is that gingivitis is completely reversible with proper dental care. However, if left untreated, gingivitis can progress to periodontitis. Periodontitis is the destructive, irreversible stage of the disease. In periodontitis, the inflammation spreads deeper, destroying the supporting tissues of the tooth, including the periodontal ligament and the alveolar bone. This destruction leads to the formation of periodontal pockets, which are deepened spaces between the tooth and the gum where more bacteria can accumulate. As more of the supporting bone and ligament is lost, the tooth becomes loose and may eventually fall out or require extraction. This process is measured by what veterinarians call clinical attachment loss, which is the destruction of the fibers and bone that hold the tooth in place. The American Veterinary Dental College has defined stages of periodontal disease to help classify its severity, ranging from stage 1, which is gingivitis without any attachment loss, to stage 4, which is advanced periodontitis, where more than 50% of the tooth's support has been lost. While early-stage disease might not cause severe discomfort, as it progresses, it can lead to extremely painful conditions like periodontal abscesses and ulcers. Many owners might not even realize their dog is in pain, as dogs are masters at hiding discomfort. The main complaint from owners is usually just halitosis, or bad breath. So, what is happening on a microscopic level to drive this destructive process? For a long time, we thought it was just a matter of too many bacteria. But recent research, much like in human dentistry, has shown it is more about a shift in the type of bacteria present. In a healthy mouth, there is a balanced community of microbes. Periodontal disease develops when this community undergoes a shift, known as dysbiosis, allowing certain highly pathogenic bacteria to thrive and cause damage. In dogs, one of the primary villains in this story is a bacterium called Porphyromonas gulae, often referred to as P. gulae. Think of it as the canine equivalent of Porphyromonas gingivalis, which is considered a keystone pathogen in human periodontitis. A keystone pathogen is an organism that, even in low numbers, can orchestrate a change in the entire microbial community, turning a relatively harmless group of bacteria into a destructive force and manipulating the host's immune response to its own advantage. Studies have shown that P. gulae is strongly associated with periodontal disease in dogs. Its presence and abundance increase as the disease gets more severe, and it is notably enriched in dogs with severe periodontitis while being absent in healthy dogs. What makes P. gulae so dangerous? It possesses a number of powerful virulence factors, which are essentially weapons it uses to colonize the mouth, evade the immune system, and destroy tissue. One of its most important weapons is a set of hair-like appendages on its surface called fimbriae. These fimbriae are crucial for the bacterium's ability to stick to tooth surfaces, form biofilms with other bacteria, and even adhere to and invade the host's own gum cells. The main protein that makes up these fimbriae is called FimA, and researchers have discovered that there are different genetic versions or genotypes of this protein. These have been classified as types A, B, and C. This is not just an academic detail, it has real-world consequences. These different FimA genotypes are strongly associated with different levels of virulence. For instance, strains of P. gulae carrying the type C fimbriae are considered the most virulent. They are linked to the most severe forms of periodontitis in dogs, cause more severe systemic inflammation in lab models, and are associated with a greater loss of permanent teeth. Beyond fimbriae, P. gulae also produces powerful enzymes called proteases, specifically a type known as gingipanes, just like its human counterpart P. gingivalis. These enzymes are devastatingly effective. They can directly break down the proteins that make up the connective tissue, like collagen. They also degrade host proteins involved in blood clotting, which can increase bleeding in the gums and, conveniently for the bacteria, releases a vital nutrient they need to grow, heme, from hemoglobin. These proteases are also involved in a host of other destructive activities, like disrupting the host's immune cells and inducing inflammation. Another fascinating and slightly concerning virulence factor is a citrullinating enzyme, similar to one in P. gingivalis that has been linked to rheumatoid arthritis in humans. While a direct link to arthritis in dogs has not been established, it highlights how these bacteria can produce molecules that have far-reaching effects on the body. Some studies have even detected P. gulae in the mouths of humans, particularly dog owners and veterinarians, suggesting that transmission between dogs and people may be possible through close contact. While the health implications for humans are still unclear, it underscores the intricate connection we share with our pets' oral microbiomes. With such a powerful pathogen playing a key role, you might wonder which dogs are most likely to fall victim to this disease. The prevalence statistics are quite staggering. While studies of conscious dogs in primary care vet practices report a prevalence of around 9 to 18%, these numbers are known to be significant underestimates. This is because a proper periodontal exam cannot be done on a conscious animal. When researchers look at studies where dogs are examined under anesthesia, allowing for detailed probing and dental x-rays, the numbers jump dramatically to between 44 and 100%. In fact, more than 80% of adult dogs are thought to have some form of periodontal disease. Several key risk factors have been identified. The single biggest risk factor is age. The frequency and severity of periodontal disease increase dramatically as a dog gets older. One study found that while dogs under 1 year old had no significant periodontal issues, signs of mild disease began appearing at age 1, moderate disease at age 2, and severe disease at age 3. In many studies, young dogs generally show signs of gingivitis, while older dogs show evidence of periodontitis and bone loss. This age-related progression is also seen with the colonization of P. gulae, with the proportion of positive dogs increasing with age, and the more virulent type C genotype being more common in older dogs. Another profoundly important risk factor is size. Over and over again, studies have confirmed that smaller dogs are much more prone to developing periodontal disease than larger dogs. A massive retrospective analysis of over 3 million medical records found that extra small breeds, weighing less than about 6.5 kilograms, were up to 5 times more likely to be diagnosed with periodontal disease than giant breeds. Breeds most frequently diagnosed tend to fall into the extra small, small, and medium small categories. There are several anatomical reasons for this. Smaller dogs have teeth that are proportionally larger for the size of their jaws, which often leads to overcrowding and malocclusion. This overcrowding creates more nooks and crannies where plaque can accumulate and makes it harder for the mouth to naturally clean itself. Furthermore, studies have shown that the gum tissue and the underlying alveolar bone are significantly thinner in toy breeds, which may make them more vulnerable to destruction. This leads us to breed predisposition. While size is a major component, some specific breeds appear to be at particularly high risk. Yorkshire Terriers are frequently cited as having one of the highest prevalences of periodontal disease. Other high-risk breeds include toy and miniature poodles, chihuahuas, miniature schnauzers, Maltese, dachshunds, and even greyhounds. One longitudinal study on Yorkshire Terriers was particularly shocking, finding that 98% of the dogs had signs of early periodontitis by just 37 weeks of age. This suggests that for some breeds, the disease process starts incredibly early in life. The specific teeth that are most affected can also vary by breed. For example, in Labrador Retrievers and miniature Schnauzers, the incisors, fourth premolars, and first molars are most at risk, whereas in Yorkshire Terriers, the canines are also highly affected. This highlights that a one-size-fits-all approach to dental care may not be sufficient. Finally, while not as well studied, there is a strong suggestion that genetics play a role, meaning some dogs may simply be more genetically predisposed to an overactive inflammatory response that drives the disease. Now we come to one of the most critical parts of our discussion. Why should we care so much about what's happening in a dog's mouth? As we touched on earlier, this is not just about bad breath, or even tooth loss. Periodontal disease is a potential gateway to systemic illness. The inflamed, ulcerated gum tissue in a diseased mouth provides a direct port of entry for bacteria and their inflammatory byproducts, like lipopolysaccharides, to enter the bloodstream. This periodic bacteremia, which can happen with something as simple as chewing, triggers a body-wide, low-grade inflammatory response. One of the ways we can measure this systemic inflammation is by looking at levels of C-reactive protein, or CRP, in the blood. C-reactive protein is what's known as an acute phase protein, and its levels rise in response to inflammation anywhere in the body. Studies have shown that dogs with more intense gingival inflammation have significantly higher levels of C-reactive protein, suggesting their periodontal disease is indeed triggering a systemic inflammatory response. This systemic inflammation and circulating bacteria can then have detrimental effects on distant organs. The link between periodontal disease and kidney disease is particularly well documented. One study estimated that for every square centimeter of diseased periodontal tissue, a dog has a 1.4 times greater likelihood of having kidney pathology. The mechanisms are thought to involve either the deposition of immune complexes formed in response to the oral bacteria in the delicate filtering units of the kidneys, leading to glomerulonephritis, or direct bacterial infection of the kidneys, leading to pyelonephritis or interstitial nephritis. A recent study looking at kidney biomarkers in dogs and cats before and after dental procedures found a clear link. The severity of the dental disease, as determined by the length of the subsequent anesthesia time needed for treatment, was linked to abnormal kidney function biomarkers, specifically an elevated urine protein to creatinine ratio, even before the procedure took place. Kidney tissue damage biomarkers were also elevated in dogs with more severe disease. This provides concrete evidence that the inflammation in the mouth is having a measurable, negative impact on the kidneys. The kidneys are not the only organs at risk. Associations have also been identified between periodontal disease and various heart conditions, including bacterial endocarditis, which is an infection of the heart valves, as well as cardiomyopathy. One study even found a potential link between the highly virulent type CP, gulae, and mitral regurgitation in dogs. Pathological changes in the liver have also been documented in dogs with periodontal disease. It is clear that maintaining oral health is a key component of maintaining overall systemic health. So, faced with this common and serious disease, what can be done? It all starts with a proper diagnosis. A veterinarian can get a preliminary idea of a dog's oral health from a conscious visual exam, looking for obvious signs like gingivitis, plaque, calculus, and gingival recession. But as we have discussed, this is only the tip of the iceberg. To truly understand the extent of the disease, a thorough examination under general anesthesia is absolutely essential. Anesthesia allows the veterinary team to perform two critical diagnostic procedures that are impossible on a conscious patient. The first is periodontal probing, where a small, blunt-tipped probe is used to measure the depth of the sulcus, or groove, around each tooth. In a healthy dog, this depth is typically 1 to 3 millimeters. Deeper measurements indicate the formation of periodontal pockets and loss of attachment. The second crucial tool is full-mouth intraoral dental radiography, or X-rays. These X-rays are vital because they are the only way to see what is happening below the gum line and assess the extent of alveolar bone loss. Once a diagnosis is made, treatment is centered around halting the disease's progression. The cornerstone of treatment is a professional dental cleaning, also performed under general anesthesia. This procedure involves meticulously removing all plaque and calculus from every tooth surface, both above and below the gum line, a process called scaling. The teeth are then polished to create a smooth surface that is more resistant to new plaque formation. For teeth with advanced periodontitis, where the supporting structures are too damaged to be saved, extraction is often the kindest and most effective treatment to eliminate the source of infection and pain. In addition to mechanical cleaning, veterinarians now have other tools to help manage the disease. One of the most interesting is an approach called host modulation therapy. Instead of just targeting the bacteria, this strategy aims to modulate, or regulate, the host's own destructive inflammatory and collagen-destroying response. The only currently government-approved host modulation therapy for periodontal disease is a non-antibiotic formulation of the tetracycline antibiotic, doxycycline. This might sound counterintuitive, but the discovery was groundbreaking. Researchers found that tetracyclines have a previously unrecognized ability to inhibit mammalian-derived enzymes called matrix metalloproteinases, or MMPs. These enzymes, particularly the collagenases, are the primary culprits responsible for breaking down the collagen that forms the structural framework of the gums, periodontal ligament, and bone during periodontitis. By using a very low, subantimicrobial dose of doxycycline, the drug does not function as an antibiotic, so it does not lead to the development of resistant bacteria. Instead, it works purely as a host-modulating agent, turning down the activity of these destructive matrix metalloproteinase enzymes. Numerous clinical trials have shown that when used as an adjunct to traditional scaling and root planing, subantimicrobial dose doxycycline is safe and leads to significantly better clinical outcomes, including reduced pocket depth, greater gains in clinical attachment, and reduced biomarkers of inflammation and tissue breakdown in the gums. There is also ongoing research into other therapies that target key pathogens like P. gulae, such as combinations of the antibiotic clindamycin with interferon alpha to reduce bacterial load and enhance the immune response, or even inhibitors designed to block the destructive proteases of the bacteria. However, no professional treatment, no matter how thorough, will have lasting effects without the crucial follow-up: home care. The benefits of a professional dental cleaning can be lost within days as plaque begins to reform almost immediately. This is where you, the dog owner, become the most important member of the veterinary health team. And the single most effective tool for preventing plaque buildup is daily tooth brushing. Studies have shown it is the gold standard for removing plaque and maintaining periodontal health. While brushing 3 times a week might be sufficient to maintain health in dogs with already healthy gums, daily brushing is required for those with existing gingivitis to prevent progression. Unfortunately, this is where a major disconnect occurs. A large-scale survey of dog owners, veterinarians, and veterinary nurses in Sweden revealed some sobering facts about dental home care. The most fundamental finding was that the absolute majority of dog owners do not perform adequate prophylactic dental home care. Fewer than 4% of all dog owners in the survey brush their dog's teeth daily, and about half never brushed at all. This is not always due to a lack of caring. A significant issue appears to be a communication gap. While the vast majority of veterinarians and veterinary nurses reported that they often or always recommend toothbrushing, more than half of the dog owners stated they had never received a recommendation from their veterinary clinic to brush their dog's teeth. Clearly, the message is not getting through effectively. This is compounded by owner misconceptions. The same survey found that dog owners as a group believed that natural chews, like rawhide, were more important for good dental health than toothbrushing. While dental chews, special dental diets, and other products can certainly help reduce plaque and tartar, and those that have earned the Veterinary Oral Health Council, or VOHC, seal of acceptance have proven their efficacy, they should be seen as a supplement to, not a replacement for, active home care. One recent study showed that daily toothbrushing was more than 3 times as effective at controlling plaque compared to using a daily dental chew or a dental diet. On a related note, a word of caution about non-professional dental scaling, sometimes offered without anesthesia. These procedures are purely cosmetic. They only remove the visible tartar above the gum line and do absolutely nothing to address the disease-causing plaque and bacteria lurking in the periodontal pockets below the gum line. In addition, using sharp instruments on a moving animal risks permanently damaging the tooth enamel. The good news from the survey is that there is huge potential for improvement. The majority of dog owners who are not currently brushing daily said that they would consider doing so. This suggests that with the right information, support, and practical demonstrations from the veterinary team, owner compliance could be greatly improved. And it is a conversation that should start early. The first puppy vaccination visits are an ideal opportunity to introduce the concept of daily toothbrushing and get new owners started on a path to lifelong oral health for their pet. In conclusion, periodontal disease is far more than just a cosmetic issue of bad breath. It is a common, painful, and progressive inflammatory disease driven by a shift in the oral microbiome and an overzealous host immune response. It is heavily influenced by risk factors like age and, most significantly, small breed size. Crucially, the chronic inflammation in the mouth has serious systemic consequences, contributing to inflammation and damage in vital organs like the kidneys, heart, and liver. But the most important takeaway is that periodontal disease is largely preventable. Through a partnership between a proactive veterinary team and a dedicated owner, combining regular professional examinations and cleanings with the gold standard of daily toothbrushing at home, we can fight this silent epidemic. We can spare our dogs from chronic pain, preserve their teeth, and protect their overall health and quality of life for years to come. So next time you get a whiff of that doggy breath, do not ignore it. See it as a call to action, and start a conversation with your veterinarian about a comprehensive oral health plan for your beloved canine friend. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.